My name is Tiffany Christensen. I am from Durham, North Carolina. I work at Duke University Health System. I work professionally as a patient advocate in Duke Hospital, primarily in the area of oncology, but I also serve as a patient advisor for Duke Hospital in helping them to expand their patient advisory programs. One of the greatest ways to affect change when we're talking about person and family-centered care is through story. To take the patient family advisory council and allow them the stage for which to tell their story in an effective way to the people who are going to then be motivated to implement those new programs, to change those policies. And for me personally, one of the greatest examples of that was a little talk that one of our advisors gave. It was very short talk. It was about 15 minutes, which as a person who gives talks, you think, what can I do in 15 minutes? That seems so small and trivial. But what ended up coming out of that little 15-minute talk was a doctor sitting in that room who said, oh my gosh, I've been doing this wrong. All this time, I have not been engaging my patients and families in a way that is to the benefit of all of us. And so from that moment, from that little 15-minute talk, she decided to change the way that she did things, and she implemented pretty quickly a whole program around patient and family-centered rounding. So the way that she rounds on her patients is very different. The way that she preps her patients in the outpatient areas is very different, and now the whole continuum of care for her patients is very different because she set the stage in a completely different way. And that all came out of, and that doesn't happen with one doctor, that has to happen with the nurses and everybody else who's rounding with that physician. That is a culture change within one surgical area, and that all came out of one patient story told on one day in 15 minutes. And that is a great example to me of how what one little pebble can be such a huge ripple, and you may not even know that all of that came from one story.